Welcome everyone as people roll on in from the waiting room. Thank you for joining us. My name is Cathy Madson. I am a certified dog trainer with Preventive Vet, and I am super excited this month to host Dr. Stephanie Austin for Yappy Hour to talk about tips for caring for senior dogs. Some quick housekeeping. Yes, some quick housekeeping before we dive in. Please keep your mic muted for the first part so that we can make sure we can hear everything. And then please have your video on if you're comfortable. We are recording this so that we can post it to YouTube for those that can't attend live so they can watch it. But we would love to have you be on video on camera so that we can see you and any dogs that happen to walk through. And if you have any questions throughout the part, please feel free to just put them in the chat discussion down in the center of your screen. There should be a little chat button you can push. I'll try to keep an eye on those questions as we go, but if I miss anything while we're talking, I'll be sure to go back through for to check those questions during the open Q&A time at the end. And we're going to be talking about a lot of stuff today for senior dog care. So we're going to kind of talk about some main points before we open it up for Q&A at the end. So definitely pop those questions in the chat and we'll make sure to address those. Let me pull up the next one here. And as a thank you for attending Yappy Hour, I want to make sure you know about our puppy essentials and dog training essentials workshops. And what those are is it's a virtual training workshop with self-paced modules, but it includes a virtual live session with me in a small group setting. And we focus on particular topics in each workshop that you do. Right now we have crate training, potty training, nipping and biting, the big one. All about barking, something that I know a lot of my senior dog clients deal with. We also offer socialization foundations. And then we just added a new workshop, which is jumping and counter surfing. And those are open to dogs of all ages. And for attending Yappy Hour, you do get 35% off as a thank you. Just use code HAPPYYAPPY at checkout. And you can learn more about those at preventivevet.com or at pupstandingacademy.com as well. So I'm super excited to talk to Dr. Austin today about tips for caring for senior dogs. I have a senior dog. Her name is Suki. She turned 11 this year in February. And we're going to be kind of going through some big topics that are really popular questions I get from clients a lot. And I'm sure Stephanie gets them a lot as well in her practice. But we're going to be talking about general care for our senior dogs. So things that we can easily do in our homes starting right away to make them more comfortable. We'll talk about some behavioral changes that we see as dogs get older. We're also going to be talking about arthritis and mobility issues. That's a big topic for senior dogs. And I have a lot of questions because I'm starting to see my senior kind of slow down and move differently. We'll also touch on doggy dementia, so canine cognitive function and how that changes as dogs get older. And we'll also talk about dental care, my least favorite thing in caring for dogs. And then vision and hearing, because as dogs get older, a lot of them start to lose their eyesight or their hearing. So, and then we'll open it up for Q&A. So we got a lot of stuff to get through first. But again, don't forget, pop any questions you have in that chat bar, and we'll address those later. Okay, there we go. Now I can see everyone. Hello. Oh, I see familiar faces. So Dr. Austin, thank you so much for joining me. I'd love to hear a little bit more about you. And so the audience can kind of hear about your experience with senior dogs and kind of how you approach caring for senior dogs in your practice.
Of course. Thank you so much for having me, guys. I'm so excited to be here. I think you guys picked possibly my favorite topic to talk about. I absolutely love senior pets for sure, and senior dogs are my favorite. I have a senior dog of my own. I've only had her for a year. I adopted her as a senior. We don't know her exact age. I got told she's about 11, but I think she's closer to 13. Collectively has about 4 teeth left. She is a Chihuahua mix. Unfortunately, don't have her with me at the moment as I'm traveling, but a little chihuahua fluffy thing, and is just the light of my life. But have also had a Labrador that got to 16 and a half. So have a lot of experience with senior pups and had her whole life. So went through from puppyhood all the way to 16 and a half and got to experience everything, and everything we're going to talk about today I went through with her. So had a lot of personal experience, and then obviously I've been a veterinarian now for 10 years and I experience this day in and day out with my clients and my patients. And it's again one of my favorite things, to talk about with clients, especially because I feel like they often feel like they're at their their wits end, where they think that there's nothing else that they can do. They feel desperate, and I come to them and I'm like, no, wait, we've got so much more room here. So something that I do feel like I enjoy a lot and feel like I can help people with a lot. So I'm very excited to talk about this stuff today.
Yeah, I love senior dogs. I love dogs of all ages, but there's something about sharing
right.
your senior dog where you're kind of, right now I have a teenager dog too, which is just awful most of the time because so like knowing that, okay, this is the crazy part, but senior dogs, you're mellow, you're chill. It's a nice time of life that I really love enjoying with them.
Right. They're just the golden oldies. There's something about them.
Yeah. So I remember when Suki had just turned 7 and she went in for her annual vet checkup, and my vet was like, oh, well, we need to start her on just like senior care kind of things, make sure you're on track. And I really thought, why? She's 7. Like, she's not a senior yet. And she's a cardigan corgi, so she's medium dog, but on tiny legs. So I was very confused. I was like, that seems really young. So, and I think this is a big question for a lot of people is, at what age do we actually consider a dog to be a senior and entering that life stage?
And that's a really good question. It's a tough one for everyone. We don't want to admit it. We don't want to admit when our dog becomes a senior because we want them to live forever. But it really does depend on the size of the dog, genetics, a lot of other factors. But typically, we can say that small dogs become a senior around the 11-year-old mark. Medium to large breed, probably closer to 8 to 10 years. And then our giant breeds typically are seniors around 6 to 7 years of age. So really tough for owners to accept that. Even myself, as a dog owner, it's hard for me to accept as well. But we just have to be prepared for that information, because denial never is good. And if we can be proactive with that information, then they are going to live a better quality and a longer life. So, as long as we keep that in the back of our mind. So
definitely. Yeah. It's kind of crazy thinking about how size plays such a role for dogs.
Yeah.
How the big dogs.
Absolutely. Absolutely.
So I kind of wanted to get some tips and ideas for general care for aging dogs into seniorhood. I know that my house has changed over the last couple of years with Suki. We also moved into a townhome, so I had to really look at ways to make it more senior dog friendly. But kind of simple things that we can do. I know that what I've done lately is I got really cheap runners, the carpet runners from Amazon. I think they were like $14 a piece, which was great, to put them around my kitchen because we have hardwood floors. But I realized with my younger dog now wanting to play, and Suki still had the energy to play, that she wanted to get into it and chase and run, but she didn't want to get onto the hardwood. She would stick to where the carpets were. So I got these runners, and we call it the Corgi Speedway, around the island, so that my senior dog has more traction. Are there any other things besides putting down yoga mats or carpet runners on slippery floors that might help senior dogs with traction, just getting around the house?
Yeah, absolutely. So things like booties are a really good idea. I did that with my Labrador too. So same sort of issue that you had. We had hardwood flooring. And that's something I noticed as well. She had a really hard time pushing up off the ground with the hardwood flooring. All 4 legs would go out from underneath her. And, we thought that, at first it was like, oh, it's her arthritis, whatever. And of course, part of that was, and before, I clicked to the cheap matting, we went for the booties, which, again, old dog, new tricks. Not that they can't learn them, but she wasn't a fan of the booties. So if your dog is trained to booties, that's a great one, indoor booties. But the matting is a great idea. Absolutely. You can also get paw balm. Like they use them on huskies a lot for outside, for salt areas, etc. I know both of us live in areas.
Yeah, mushroom.
Yeah,
I think it's
exactly. Yeah, so both of us live in areas that snow, so you can put that for traction on indoor paws, as long as you don't mind having the marks that go around on your wood floors. But definitely the best thing you can do is cheap carpeting or cheap little pieces of flooring, yoga mats, etc. At least, runners where they can have a little walkway, we called it her supermodel carpet. She'd have a little runway that she could just get from A to B, so that she had a walkway for her, especially little dogs as well. So now my dog is obviously downsized a lot from a Labrador, stairs and ramps to get up and down things, so that they're not having to jump or launch themselves on and off things.
Yes,
absolutely. Just,
I'll pull up a photo here really quick of Sookie and her pet stairs. Can you, everyone see? Okay. We got these. I have multiples of these around the home, and they have been awesome because I've seen Sookie kind of hesitate to jump up onto the bed or onto the couch. And I think she's just like, oh, I know that's going to hurt, so I'm not going to do it. And so getting these little pet stairs and putting them by the bed, by the couch she likes to lay on. I have one in my car that I just pull out whenever she needs to get up into the car as well. So they have really lightweight ones that make it easy to incorporate into the house.
And that's an amazing idea. Yeah, for cars as well, because dogs are going to want to do what they are used to doing, and often they don't know their limits either. So you have to be their eyes for them a lot of the time, and have to help them with their limits. We're just as bad. Oh no, I can do this half marathon, and you can't. Someone has to tell you, maybe not this month, but maybe in 3 months, or whatever it is. So we have to be their keepers. We are their keepers. So really, we have to help them help themselves. So things like that are a really good idea.
That kind of goes into the fitness and conditioning part of having an aging dog, which is something I've been diving into recently, and it's really fun, where rather than waiting until my dog has major issues moving around, I want to kind of address the loss of muscle mass that I'm starting to see in her back end sooner rather than waiting later. And this is something I took a virtual course through Fenzi Dog Sports Academy. It's all online. And it was Fitness for Aging Dogs by the amazing Lori Stevens. She's a certified canine fitness instructor. She's actually up here in the Seattle area near me. But she really approached it as, don't wait so long that your dog now needs a doggy wheelchair. Start sooner in starting to condition your older dog and keep them at a fit level so that they have a better quality of life longer and don't just kind of waste away with their muscle mass, and they're able to stabilize themselves like when they get up off of a slippery floor. And so I really recommend, for anyone who's interested in canine fitness, check around, talk to your veterinarian. I know that there's rehab veterinarians that do a lot of conditioning and fitness. Is that right?
Yeah, absolutely.
Yeah. So I know that regular veterinarians should be able to refer out, but then there's also certified trainers that can do it as well. A lot of them are going now. So that's awesome.
Yeah.
But they showed me awesome things to start with Sookie, just to get her used to standing, like say on a balance foam pad. This is a human version. There's dog versions of all of these things that I swear are like 10 times as pricey because they're for dogs. But the human version of this, so kind of teaching Sookie how to just stand on this, and it's working her core and it's working the muscles that she needs to stay strong and stabilize. Or a lot of people will do, now my dog's like, oh, we're going to exercise? Or like a balance disc as well for the more advanced stuff. So these are all things that you can buy pretty cheap online. and then get into a little virtual class and learn how to introduce your dog to these things, build them up to higher and higher levels of conditioning and fitness, rather than being a weekend warrior and thinking you can run a marathon right off the bat. And that
Exactly.
strength, you know. So
yeah,
really
exactly.
the canine fitness and conditioning for older dogs. And then this quarter I signed up for fitness for long back dogs because I have corgis. So I was like, ooh, next level. And I'm starting the same kind of exercises with my teen dog because I was like, you know, it would have been awesome to start this with Suki when she was younger, so that maybe she wouldn't have lost so much muscle mass to begin with before I actually started paying attention and what can I do about it. So that proactive piece of it's so important.
And that is absolutely key. That's, you absolutely hit the nail on the head there. It's being proactive. And that's the main thing. That's the main takeaway here. And I wish I'd known that before my lab got to the point where I was like, oh, wow, you know, she's having trouble standing because she's lost a lot of muscle mass. And yes, she has arthritis, and sure, it's genetic in Labradors. I got very lucky that I got a Labrador that didn't have a lot of genetic arthritis. But, you know, she lost a lot of muscle mass because, you know, while I was younger when I had her and wasn't quite yet a veterinarian and things like that, you know, I certainly wasn't paying attention to the signs of aging because it just wasn't, you know, in the forefront of my mind. That I wish I had thought about these things, you know, when she was Suki's age and had been proactive about, you know, doing things like you're doing now. Where, you know, I was doing all of those exercises and had taken a class and done all of that. I mean, don't get me wrong, 16 and a half is an incredible age for, you know, a medium to large breed dog or large breed dog. But, and I'm not saying would I have gotten more time out of her? No, probably not. But could she have been in better physical condition? Maybe, etc. But, you know, anyone else out there with a dog that's Suki's age or even younger, do these things now. So that they can be in great condition, their quality of life is better. Perhaps they can be on less medications that we can go into later, etc. Just at the end of the day, it's all going to be a positive impact on their quality of life and yours at the end of the day. So, and they're just such simple things, 5 minutes, 10 minutes a day.
Yeah.
So.
Yeah, I know they started like when I was learning all the different kinds of very basic, it feels like exercises, but I see Suki start to tire after about 3 to 4 minutes, which from what the instructor was saying is like, that sounds about right. It's actually a lot of work for them. So what are some signs though? Because if we start exercising with our senior dogs, whether it's conditioning or if it is just going on walks, your regular walks or your regular kind of play exercise, what are the signs to really watch for in our senior pets that they're getting fatigued or tired that tells you you need to stop so that you prevent soreness and that fatigue?
So classic one is just slowing down. So the dog that used to pull on the leash or the dog that used to walk ahead of you, maybe even beside you, is now walking behind you or stopping more frequently, etc. And, you know, you want to keep going because, oh, you know, she used to walk 3 miles with me and now she doesn't. That's her telling you that 3 miles is too much. You know, 3 miles is just not something he can do anymore. And although maybe you want to be able to do that with her because, you know, again, denial is such a wonderful thing. We want to be like, but she's not old. She's not getting old, but she is. And that's okay. We all age, but let's age gracefully and let's honor the aging process. And let's do it in a way that they can age gracefully, but still do it, you know, in a way that we can honor that and make sure that they do it as comfortably as possible and that they can still do it and still enjoy it with us. So it's okay to walk a mile as long as they do it and not go home and have to sleep for 3 days and are in pain and have to be on medication. So, you know, things like, okay, we're panting, we're stopping all the time, we're having to lie down on a walk. You never want to see a dog lie down on a walk or limping on a walk. They're all very, very classic signs of we have overdone it today. So, or after the fact of sleeping all the rest of the day or limping after a walk or for the next day, etc. We really overdid it. So, they're the biggest classic signs. So if you notice any of those things on your walk, stop, turn around, go home. If you have a small dog and you're lucky enough to be able to pick them up and carry them home, definitely do that.
Yeah, I think with Suki, I was telling you about this earlier today, Stephanie, where I went on a longer walk than usual with Suki, and she seemed fine the whole time. And it was a nice day, and we weren't running, or it wasn't like, go, go, go. I was like, oh, this is nice that she's energetic. But then she came home, took a nap, and then was so stiff and sore. And it took about 3 days for her to get back to normal. And I felt so bad because I kept thinking I should have really worked up to that. And I should have not just gone with it because she seemed fine. She was having a great time. She gets all the smells.
Yeah.
She's not thinking ahead as, oh, I'm going to hurt later. She's just like squirrel, right? So
exactly.
So thinking ahead for the dog, and then making sure, that you're incrementally adding, a little bit more exercise, and then really gauging how they're doing with any addition as you go is so important. But
exactly. And that's the other thing. Yeah, exactly. And that's the other thing, if you have a dog that has such a great personality like Suki, they may not show you that they're bothered, or maybe they're having a great day and they're feeling great and they'll go for that 3 miles, but it's going to catch up to them later. So be really careful with a personality like that, because they'll go for that 3 miles and they're going to have a great day, and you're going to have a great day. And for 3 days later, they're going to sleep. And you're barely going to be able to get them up to go outside to go to the bathroom. And we don't want that risk. So, as much as that 3 miles seems great, you're having a great day, for the next 3 days, you're like, bummer, I overdid it. I'm so sorry. So, we were also talking about, and I'm sure we'll get into it later, about things that you can do to still be able to get your older dog outside and enjoy it. And, and there are some great techniques that you can employ to do that. Again, we can talk about the different things you and I have both employed with our senior dogs to do that.
We'll get into that for the enrichment part of it for sure. I have examples. I did want to, there's been a couple questions, and I'm so sorry if I missed, or like if anyone put it in and I miss it right now, but there was one that came in that I thought was pretty particular to kind of what we were just talking about. From Lisa, big question about pain. How can you tell if they're in pain without limping signs? So are there any really subtle signs of pain in dogs? I know it's very hard to see, just like in cats sometimes, because I know dogs don't want to advertise they're in pain a lot of the time. But what do you look for, subtle signs that aren't so obvious, like a limp, to tell if there's pain?
That's a really good question. So often they'll pant, particularly if you're on a walk, they'll pant, which is also really hard to tell because dogs will pant because they're hot. They'll pant, when they're anxious too. So it's a really hard one to tell if they're in pain. So sometimes you just need to try and deduce, okay, I'm out on a walk and, it's 40 degrees outside. So are you panting because it's hot? Well, it's 40 degrees. So no. Are you panting because you're anxious? Well, there's no reason to be anxious. We're in our normal neighborhood. There's nothing scary around. Are you in pain? You're walking behind me. You're not walking as quickly. You keep stopping. Okay, maybe it is pain. That would make most sense here. So you have to really use your powers of deduction. And then other times, are they in pain if you're at home? So, okay, you haven't want to get up off your bed. You're panting. It's cool in the house. We're not anxious. Maybe you don't want to eat either. They may all be sort of symptoms of classic sort of pain, or uncomfortable when you touch them, or they may whimper if you go to near a leg or something like that. They can all be symptoms of pain as well, especially if you have a really stoic dog, that don't show signs of pain. So they can all be symptoms as well.
Yeah, what I've noticed with Suki, and something that I've noticed with some of my senior dog clients, is as I'm petting them or stroking them and I hit a spot, I'll see them close their mouth and kind of stop breathing for a second, which is what I would do, right? If I'm in pain. So that's when I'm kind of like, hey, you need to talk to your veterinarian, get this checked out, right? Or they seem really, jerky. If you're going to reach for their ear, maybe there's painful, ear infection going on. Have your veterinarian check it. So, and this is where I always tell clients, your dog better than anyone because you live with them. and you're with them so much. So if you notice any kind of change, whether it's we're handling them or their normal behavior is something changed, that could be an indication of pain or another underlying medical issue.
Exactly.
And a lot of behavior problems that we're going to talk about are so related to pain and underlying medical issues as we go. So
exactly. I also find that, sorry to cut you off, I also find that sometimes dogs will lick the joint that may be painful. They'll actually end up licking it because they think that licking is soothing, and they don't understand that, you know, their tongue is rough, etc. So you may find that a dog will lick an area. So if, say, it's their wrist or what we call their carpus, you know, you may find that they're just licking it constantly. So if you just find your dog is just lying in their bed, just licking at, you know, what we call their wrist all the time, that may be an indication that that joint is very uncomfortable for them. So that's a really good point. And your point of like stopping their panting when you get close to that joint is a really, really good point. I had a little French bulldog that did exactly that when I would palpate its neck every time. And, you know, it wasn't very clear that it had neck pain, but every time I got near its neck, it would just all of a sudden, just like, it was like its little eyeballs would open up like brighter and its mouth would stop panting just as you got close to it. And I was like, every time. And we're like, okay, neck pain it is. You know, if only he could tell us, but
if only they're trying to, in very subtle
very subtle ways. It's their way of speaking English.
Yeah. Great question. So I want to dive back into kind of the general care. And I have a big question about this in regards to feeding for senior dogs. So I'm at the point where I'm ready to transfer Fozzie Bear, my teen dog, into adult food. And Suki has been on her regular food for years now. And I've been feeding her like a lower amount based on what's on the back of the bag. And I feed first mate. And so I've always kind of wondered, when do you start feeding senior dogs the senior formulas? And are those formulas great? Are they a good option? Or is it just the calories, so you feed them less? At what point do you start that? And kind of how do you decide how to feed your senior dog differently?
Yeah, so also a really good question. I mean, the idea behind senior food basically is that the idea is that they have less calories and less fat, and typically lower protein, because what they're trying to do is they're trying to take the most common senior issues and put them into a food. At least the commercial diets are anyway. And you know, combine them into the most common problems, put them in a commercial food, and then market them to senior dog owners. Not every food is going to be the same, and everyone is going to vary slightly, of course. So first things first, always talk to your veterinarian before just running out and buying a commercial senior dog food, because it always is going to depend on what your senior dog has and you know, what diseases they may or may not have and what nutritional requirements they have, because you don't want to all of a sudden cut protein if they have an issue where they need protein. You don't want to cut phosphorus if they have a need for phosphorus, because a lot of senior diets will have a low phosphorus and a low protein, because a lot of senior dogs have kidney issues where they are things that we want to have diets low in. But the biggest thing is that aging is typically associated with lower energy requirements, right? You think of your grandmother. My grandmother is an amazing human being, but she certainly doesn't get out and run as much as I do, okay? I'd love to say that she did, but she certainly doesn't. So she also doesn't eat as much as I do. So, you know, my dog probably sleeps 22 out of 24 hours a day. As much as I'd love to do that, you know, she doesn't. So she doesn't need as much food as, let's say, Fozzie Bear does. So they definitely decrease the amount of caloric intake. So again, there's a huge adjustment in what is contained in those foods. But one of the hugest things being that we're trying to curb obesity in senior dogs. Huge thing being that not only is obesity a huge problem in just canines in the US, but in our aging dogs as well. You know, it's something like, I want to say the percentage is something like 40 to 45% of dogs aged between 5 and 11 are weigh in at a higher than normal weight. Like, that's insane. That's ridiculous, you know? obesity is a huge problem in dogs in general, and obesity shortens our dog's lifespan, and no one wants to hear that. Like, we want our dogs to live forever, right? So we've got to be really careful about that. And obesity leads to all kinds of other problems in our dogs. One of the biggest things, and something we've just been talking about, is obesity directly relates to mobility, directly relates to arthritis, directly relates to quality of life. So, the biggest thing is you should start feeding a senior dog diet when they hit that senior age, which is one of the first things we talked about, that 10 to 11 if you have a little tiny dog like mine, that 8 to 10 if you have a medium-sized dog, which technically I think your guys fit in medium to large, and then if you have a Great Dane / miniature horse, they're 6 to 7, right? But again, always talk to your veterinarian first, and then talk to them about their preferences and why they have those preferences.
Yeah. And then they can also really look at your dog's body condition as well, rather than just the weight on the scale. Because I know that for my dogs, I was talking to my veterinarian about it, and we've actually wanted to keep them on the lean side, which is funny because for corgis, people have come up to me and said, your corgis are too skinny. And I kind of want to just go, no, right? Because people are so used to seeing fat corgis, and fat corgis are adorable, right? They're just little roly-polies, but they're obese, and it's not healthy, especially for long back dogs. And so that's why my vet was like, let's keep them on the skinnier side so that you don't have as much risk for back injuries, which are already high because they're long back dogs. And so let's do what we can with their weight and their fitness to keep them on that slimmer side so that we don't see any obesity kind of related things like more arthritis risk and all of that. So it's definitely the body condition, and your veterinarian can really walk you through it. Cause I know they have those charts that like 1 to 5. And so or something, there's a lot of them now where they rate it, where you want to see a nice tuck, in the dog's body. You want to see a waist if you're looking at them from above. And so then if the dog scores a little on the heavy side, they can also help you kind of determine, how are we going to cut back calories? How are we going to do healthy exercise for a senior dog to increase the caloric burn, right? And burn off some excess weight as well. So veterinarians are like my favorite resource for weight loss and all of that stuff and feeding. So it's so important to do. Do you want to be involved, Fozzie? Fozzie wants to say hi.
He's like, yeah, let's talk about how skinny I am. And that's a very good point. Oh, Fozzie Bear. I got told the same thing with my Labrador, that I got told that she was too skinny. I was like, no, she's an accurate weight for a Labrador. It's just you're used to seeing fat Labradors.
Yeah.
So, and the same thing, don't be afraid to have a dog that is actually an accurate weight. You're doing the right thing for your dog. So talk to your veterinarian about it. Because, at the end of the day, you're going to have a dog that has a better quality of life and possibly even lives longer. So, and that's what we want at the end of the day.
Yeah, definitely. And kind of on the flip side of eating too much and obesity.
Yeah.
With aging dogs, and I've noticed this with Suki over the last few months, last year. And part of it, I think, is because I brought another dog into the house, but she got more picky with her eating. She wasn't wanting to eat as much as she had before. So I was worried that she wasn't getting enough calories, but I managed that with some treats and training and like working it in other ways. Do you see a lot of senior dogs kind of have a lot of weight loss because they're not eating, like loss of appetite? What does that look like for senior dogs?
So it definitely can happen. So it definitely will occur when they get a little bit older. What will happen is their metabolism will slow down just like a person. It can occur because of metabolic reasons. So maybe they do have a metabolic condition, so hypothyroidism, so their thyroid slows down just like a person. They can also get other metabolic conditions as well. So the first thing to rule out when you start to notice something like why they're maybe not eating as much is to have a physical exam done by a veterinarian. Let's start at the front and work all the way to the tail. I call it a nose to tail exam. So first thing to rule out is teeth. Okay. And I know we're going to get there when we're talking about dental issues today. But let's rule out the most common reason of why I don't want to eat. Are my teeth hurting me? Are my gums hurting me? Am I not wanting to eat because of that? And then metabolic issues, do I not want to eat because my thyroid isn't working properly? Is my stomach not working properly? Is my adrenal gland not working properly? Is there something else going on that needs to be addressed? And then, there's the case of I'm not getting enough exercise because I'm, lazy and slow because I'm older. So I just don't have the metabolic need for that much food anymore. So I'm just not eating as much. So that's absolutely possible as well. And therefore we need to talk about that adjustment in caloric intake. So do I go on a senior diet or a diet that, maybe is called a weight loss diet, but it really is just a caloric deficit essentially, and determine what that looks like for your dog.
Kathleen is a great question about weight. She asked, what about keeping weight on? I feed my Dane mix 2 to 3 times per day, a cup of kibble and a can of chunky food. She's mid 80 pounds. So if you are seeing weight loss in a senior dog, what are ways that you would try to back the weight back on so that they are healthier that way?
Yeah. So again, same thing. So then we have to work out, is there another issue? Same thing, nose to tail exam first. Let's rule out, we want to make sure that there's no medical conditions first, because I would always hate to blame it on something, try and make a quick fix out of it. And then it turns out that it could have been something medical and that we've ignored and potentially could be getting worse while we're trying to do quick fixes. So it's always a good thing to get a medical exam first. Make sure that it isn't opposite. Is it hyperthyroidism, which isn't that common in dogs, but it has absolutely occurred. It happened in my very first year as a veterinarian, which I got told by an internal medicine specialist that I'd probably never see it ever again. So it does happen, as well as some other medical conditions. Let's rule out those things first. Great Danes have a very high metabolism because they are a big dog. So then we have to look at, do we need a high caloric food? And something that is high caloric, but not necessarily high fat. People mistake high calories for high fat, and we don't want to do damage to organs that can't tolerate fat. So then we need, high fiber as well as high fat, etc. And it's just talking to your veterinarian about what's a really good diet for this dog. So maybe a senior food won't necessarily be the right food because that has a lower calorie intake. But we still want to have good contents of senior foods that include things like omega-3s and joint supplements, etc., in the food. So there's other ways to get those in there. So again, talk to your veterinarian about, let's start with the basics. And if you've done all that, like the blood works and all the rest of that, and it comes up all clean, that's great. So now let's talk about, where can we get nutrition for your dog? Do we need to talk to a veterinary nutritionist about where the best thing is to go for your dog? You do have a very big dog, it sounds like, and what's the best solution there? But where we can work out where the nutrition can come from.
Yeah. And do senior dogs tend to maybe be, not weigh as much because they're losing muscle mass as well? Is that normal?
Exactly. So they tend to lose muscle mass. Same thing. They slow down, they lose muscle mass. Unfortunately, they're not using their muscles as much, which reverts back to what we were talking about in, let's start to get them to use their muscles before they lose them. So, we've got to think about it when, they're Suki's age rather than 15, so they do lose muscle mass, and it's just a case of not using, you don't use it, you lose it. It's just like learning a language. You don't use it, you lose it. So, same thing. You've got to get them moving, got to keep them using it. So they will lose muscle mass, which will look like weight loss on a scale, but won't necessarily look like weight loss unless it is a really dramatic muscle mass loss. So like someone said to me the other day, oh, my dog lost 2 pounds. Why is it a 2 pound loss? But they didn't look necessarily any different, but it was just a muscle mass loss. So unless it's a dramatic muscle mass loss, then you're not going to necessarily see it.
Right. I always say, well, and I know the term everyone's like, oh, muscle weighs more than fat, so and I'm always like, oh, I wish that was true for me. Right?
I know, right?
To work the muscle.
Me too.
But yeah, it's kind of, there's so many things. And so veterinary nutritionists are a great resource to kind of dive in.
They really are.
Look at the diet as you go. One other question came in related to food that I can see right now. And again, if anyone has a question and I don't get to it, I'll make sure to come back in Q&A. from Lisa. My 13-year-old is on meds for thyroid. She eats everything she can. I've heard that about dogs on meds for thyroid stuff. If she finishes before my teen dog, she eats her food as well and is always looking for food in the kitchen. Is that unusual? My first question is it a hound? Because they were always looking for food. So not unusual, but medically on thyroid medication, is that kind of ravenous behavior usual? It's a Labradoodle.
A Labradoodle. So you got a Labrador there. So I like to call them Labra vacuums. So not unusual at all. It particularly being a Labrador mix, and not unusual being on thyroid medication either. I'm sure you probably do regular checkups on the thyroid testing. So make sure that thyroid testing is done regularly, making sure that they're on the correct amount of thyroid medication. Typically, if they're on the correct amount, they will still act pretty ravenous, but shouldn't be too ravenous. I would suspect if they're super, super ravenous, maybe just getting their thyroid levels checked to make sure that that thyroid medication isn't too high, and they're not now hyperthyroid, and go from there. But it is pretty typical. You know, unfortunately, with thyroid medication, it does mess with their metabolism a little bit.
Yeah. Great question. I want to dive into just enrichment for senior dogs really quick before we get into some behavioral changes that people might be seeing, and then diving into things like arthritis and particular things that we had a couple questions sent in about, and probably have questions coming into chat as well about. So we kind of talked about physical exercise for senior dogs, but I think a lot of times we forget about the mental exercise that we can provide for our aging dogs that can help balance less physical exercise. And I love mental enrichment so much for dogs of all ages, but especially the dogs that can't really move around as much as they used to, can't play fetch, can't go on the jogs with you anymore. But things like going on saffaris, and a safari is really just a wandering around, following your dog on leash, letting them go where they like, as long as it's safe, and getting to sniff and stare into the air at nothing, supposedly, you know, like they get to enjoy the environment around them, take in all of the smells. There's no agenda to go from point A to point B and then back. So it's not a structured walk. And I will include in the follow-up resources for everyone that I'll send out tomorrow, a video showing you how to do saffaris with your dog, what you'll need, what it looks like with Suki, so that you can kind of see what it looks like and how much enrichment it provides. Dogs are so nose driven that just allowing them to smell new things outside of their, you know, little front yard or their patio. As an aging dog, you might not be able to walk 10 miles, but just getting the smells and reading the P-mail, you know, on that block that you go.
I was gonna say that. That's what we call it, the P-mail.
Yeah, because I know that you were telling me that your dog loves saffaris and really doesn't really go that far, right?
No, yeah. When you weigh 6 pounds, you don't walk very far.
But you still get all of that information and it's working your brain. So safaris are one of my favorite ways to provide enrichment for senior dogs. Yeah. Other ways I like to provide enrichment are taking their meals and making it more interactive. So like puzzle feeders. Everyone probably knows what a Kong looks like and is. Fozzie's like, is there food in that? No.
You can see his little ear pop up there.
Kongs are great if your dog is familiar with puzzle toys and knows how to get the food out. It's not super easy actually to get food out of a Kong, especially when it's all the way at the bottom, or if it's been frozen and wet down and all of that. So I actually really like the Westpaw Topple, and these I will put in the resources follow-up so that you guys can see what these look like in the different sizes. But the reason I like this a little bit better, especially for seniors and for dogs who've never done puzzle toys or get frustrated really easy, is that it's a big opening. So it's a lot easier for them to get to the food inside. It's easier for us to clean when they're all done rather than trying to like get all the gook out from the bottom. So it's a little bit more senior dog friendly, also really good for puppies who are introducing them, like getting introduced to puzzle toys. But I really like the stuffable toys for meals because it's giving them that mental workout while getting their calories in. Other enrichment, the licking mat. the classic. Licking is soothing. If you have a dog who likes to lick, I know Stephanie was talking about this earlier, it could be a sign of pain. Sookie will do it on her feet, and it's kind of, I call it her tick because we've ruled out pain with our vet, but she likes to do it, and it can be a sign of anxiety as well. And so I replace her foot with a licking mat at a certain time of night when she likes to do it. It's like her routine, where I give her something appropriate to lick on, a little bit of her wet food kind of smeared on there, a little bit of xylitol-free peanut butter, so make sure it's dog safe, or even a little bit of Greek yogurt. And that way she can lick something, right? Work at it. Takes forever for her to do this. It's soothing for her, so it's a great one for anxious senior dogs. Licking is really calming. Same with chewing. And then kind of going back to that Sniffari idea, but bringing it inside, I feel like I'm at a magic show, like pulling out random things. Snuffle mats are fantastic. So it's just like grass, but inside. And this one is an official dog snuffle mat, but you can make your own. You can go to a local home goods store and buy a bath mat with long grass-like things on it, and then spread some treats or their kibble in there so they have to snuffle it out. Stephanie, you were saying that your dog you want to try a snuffle mat with, even though she has like what, teeth?
She has like no teeth, but she eats dry food. She's a complete and utter strange phenomenon of dog, and eats dry food and loves it, but eats it so quickly that I want to get her a snuffle mat. I think she'll think it's the best thing since sliced bread. So I like your idea. I'm going to go to Home Depot when I'm back and get her a bath mat. Yeah. Because it'll be 3 times her size, first of all. She won't be able to find her food for a week. So it'd be great.
3 snuffle mats in my house, and one's really big, right? And it takes about 10-15 minutes to finish a meal. And then Sookie, she'll go in after he's done just to make sure. And so it keeps her brain too.
Right.
So it's just great enrichment to keep their brain going. And really, keep their muscle, that brain muscle going too. So really think about enrichment for dogs. And the last thing I'll show you is this is a canine sport sack. You're not getting in it right now. But it's a dog backpack, which I love. I don't necessarily love that my dogs weigh 30 pounds a piece. I need to condition myself for that. But for those with smaller dogs, I mean, they make these for up to like Springer Spaniel size, but for smaller dogs, getting something like a dog backpack or a little tote bag. One of my coworkers had a tote bag for her senior dog. That is a way to bring them out and about, but not have to have them walk the whole time, right? So if you're kind of seeing some of that signs of fatigue, you can put them in a little bag, but they still get to see what's going on. They still get to smell everything and hear everything. So that enrichment's still there, and they're still getting to be with you, right? And experience different things. And then I know for the big dogs, things like little strollers, they have strollers. And then what did you use with your lab?
I had a radio flyer cart, one of those, not the metal ones, but the fold out ones, because she got to the point where we also had a help them up harness as well, because her back legs were just quite bad. And that was more to get her in and out of the car, the help them up harness, because she would do what we were talking about before. She thought that she was still, an 8-year-old lab, and she could launch herself in and out of the car. And so it was more to like, she wanted to launch herself, and we would just be like, yeah, you got this. And we'd lift her in. She wouldn't have an idea. But a radio flyer cart that, it would fold out. We'd leave it in the car, and then, pop her in it. People use them at the beach, and we'd drag her along. And she just thought it was the best thing, ever. Like wind in her little floppy ears, and she'd still get her little sniffaries. And so we could walk all along, and she'd be able to do her thing without having to put all that pressure on her walks. And then with my little girl now, I have a backpack similar to yours. I'm a big runner. She obviously can't keep up. And I put her on my back, and I do my runs. I go for 5, 6, 7 miles, and she comes with me. And then I take her out at the end, and we go for a little walk, do a little sniff about, and then she goes back in, and we go back again. So it's a great way for me to feel like I'm not leaving her at home for hours on end. but she still gets out and about, and I feel like I've entertained my dog. So, you know, it's great. There's so many different ways of getting them out and about without dragging them around for hours and hours, and then them, you know, reaping the repercussions of it for days later.
Yeah, definitely. And especially with a younger teen dog where I'm like, you have energy for days. Like we went on yesterday and I was like, we're going on the short loop because Suki's with us. But if I want to burn his energy a little bit more, if I have her in a backpack, maybe halfway through, in, that's a way to still have her be a part of it. But I don't want people to feel bad if they have a younger dog who needs that more intense physical exercise and activity. As long as you're balancing out your senior dog's enrichment and one-on-one time with you and making sure their quality of life is good, don't feel bad leaving them at home if you know that that activity is going to exacerbate pain or arthritis and all of that.
Exactly.
Sure that you're advocating for them, because otherwise they'll be like, yeah, I can go that far.
Exactly. And then you feel guilty too, because then for 3 days they're like looking at you and feel uncomfortable. But there's so many different ways of doing things now. Like I live in the city in New York City, and I see so many dogs in strollers. I see cats in strollers too, but I see so many dogs in strollers. So, you know, it's great. I love that people get them out and about. So,
okay. So I'm going to talk very briefly about behavioral issues that we see with senior dogs. And then we're going to talk about kind of the arthritis, vision and hearing, all of that. Honestly, behavioral issues that we see as dogs get older, they're like humans in that we tend to see a little bit, maybe some aggressive behavior pop up in senior dogs, mostly always related to pain or an underlying condition that's starting to show. So osteoarthritis pain, it hurts, right? And so if someone reaches for them, or if there's a child in the home, they're a lot more snappy and defensive, right? Which we then call aggressive, because they're in pain, right? Or their ear hurts or something. And so they respond more defensively. Also, they might be more aggressive, quote unquote, towards other dogs in their space. And this really just goes to being a little less tolerant of the shenanigans that younger dogs might be doing. Just like me, as I age, I'm a lot less tolerant of crazy behavior, right? And so I'm a little bit snappier when something's getting on my nerves. And so for senior dogs, especially if there's another dog in the home who's younger, more energetic, you really do have to manage the space and make sure that the younger dog is listening to the lower level cues of, hey, back off, right? I don't want to play right now. Stop chewing on my face. Like all of these things, this is my life right now, is managing that younger dog, giving them something appropriate to do, burning their energy off as needed, and really making sure the senior dog has the space and management so that they can feel comfortable and that they don't have to react aggressively to tell another dog off. But always with senior dogs, especially all dogs really, but senior dogs especially, whenever I have a client say, you know, they started doing this weird behavior, something's different, go to your veterinarian. Make sure that you rule out any possible cause, pain, thyroid issues, whatever it might be. And then we can look at the behavior in that context. If there is something diagnosed that they notice, or if it's a clean bill of health, it's just a dog getting older, then we'll look at managing the environment and changing the behavior that way. We do sometimes see increase in anxiety as dogs get older as well. I think this is related to pain, also can be related to doggy dementia that we're going to talk about a little bit later. But also just aging. I'm getting more anxious as I get closer to 40. So yay. So I think it's just something that as you age, you do get a little bit more aware of what's going on, or maybe you are losing your vision so you can't see as well. And so that increases anxiety. Maybe you're more in tune to noise sensitivity. And so you're starting to see more noise phobia from senior dogs that wasn't there when they were younger. So it's kind of just the brain changing as they age, also connected to the physical changes they're going through. That's usually what I see with my senior dogs. But if anyone has seen particular behavior changes in their dogs as they age, pop it in the chat so that we can see another example. we go. Okay, arthritis and mobility for senior dogs. This is a big topic. We're not going to be able to, it could be like its own 3-part Yappy Hour. But I did want to talk about ways we can be proactive. So if our older dogs aren't showing huge signs of arthritis, what can we start doing? What can we start doing with like Fozzie Bear, who's not even 1 yet, you know, to lessen the chance of osteoarthritis as he ages? And then what are kind of some things that we can do to help our arthritic dogs feel more comfortable and have better quality of life? What kind of pain meds do veterinarians kind of look at when it comes to osteoarthritis in dogs?
So they tend to, or we tend to, look towards the non-steroidal anti-inflammatories. So something like the equivalent of Advil in dogs. So I call it doggie Advil because we definitely don't want to be giving people Advil to dogs. It can be toxic. So things like names you would have heard of before probably are things like Rimadyl. That's a pretty common one. We look at those types of things when we are worried about things like arthritis, but we don't want to be giving it out willy-nilly. It can, just like people, have direct effects on our kidneys, on our liver, and also on our intestines. So people complain of an upset stomach when we take it on an empty stomach. You know, people may have any kind of vomiting or diarrhea. Sometimes, you know, taken too often, you can get ulcers of the stomach. All the same symptoms occur in dogs as well. And it's metabolized through the kidneys, or depending on the product that you use, through the liver as well. So using it too often or long-term can cause detrimental effects. So it's not something, again, we want to be using long-term. So before you just go and want a prescription, or you'll find that your veterinarian may not refill the prescription all the time. You know, your veterinarian's going to ask for blood work or, you know, things like that. So it's definitely something that you want to check with your veterinarian first. Check, do they definitely need it? Have you had x-rays done on your pet? Is it something that they definitely are absolutely in dire need of? You know, if they're absolutely in acute discomfort, then sure, short-term course of anti-inflammatories is absolutely necessary. Or I like to do an on-off course of. So, you know, a couple of days on, a couple of days off, or weeks on, weeks off, whatever it be. There are other anti-inflammatories out there that are a little bit better for senior pets. One of them is called Galliprant. It's a newer, I say newer, it's probably been out for about 10 years, but in medicine that is considered a little bit newer. That works a little bit differently on how it is processed through the body, and has a little bit better effects on the kidneys, or lesser effects, I should say, on the kidneys. A little bit safer. Something I had my Labrador on, and again, she was on it consistently, but that's her metabolism and the way it affected her kidneys was just a little bit better than perhaps other dogs. So just something to talk to your veterinarian about. Like, have you heard of Galliprant? Is that something you would recommend for my dog? If they need it all the time, and she got to the age where she just needed it all the time, you know, just like people with arthritis too, they have to take Advil every day. So that's one. Then something that maybe isn't an anti-inflammatory, maybe just a straight pain medication for just straight up pain. So typically we like to use something like gabapentin. That was actually an anti-seizure medication for people for a while, and now is been shown to have very good analgesic, which stands for pain, in a lot of animals. So especially used for disc disease in dogs. So long back dogs often gets prescribed when dogs have a disc problem. So that's something we use quite a lot as well. That's a little bit more of a serious pain problem. Like, I really hurt myself. We need some strong pain medication for a couple of days. So they're the typical ones, but I prefer not to jump to really serious pain medication or serious anti-inflammatories for a long time. You know, I know we've talked a lot about prevention is better than cure. So I like to think about supplements first, and starting supplements before we see problems arise, because you can't take arthritis back. There's no undoing arthritis, but you can prevent arthritis from starting with things like caring for your pet before it starts. So I like to think about supplements first.
And what kind of supplements do you use with your senior dog?
So I like to use things like joint supplements are a great thing. So I have a supplement brand that I love called, it's actually called Wild One. They are a great company. They just started their supplement line, and they have a great supplement line that do joint supplements. They do probiotics. They do skin and coat, and they do another one that I can't think of off the top of my head, but I have my little girl on the skin and coat and joint supplement one, and I absolutely love them. They have no artificial ingredients or any ingredients that you can't pronounce. None of those something or other acid, something acid, and something else acid. I'm like, I don't want my dog eating acid. Like, that sounds terrifying. Like the inactive ingredients are things like pepper. I'm like, oh, I know what that is. So,
I Dasequin, I feel like is a pretty good one too.
And Dasequin, I had my Labrador on Dasequin for the longest time, and that was just her absolute go-to. And I love Dasequin for big dogs. Not saying that the Wild One doesn't work for big dogs. It's just what I was my go-to for the longest time until I found these other ones. So I definitely recommend any dogs being on joint supplements. You get to middle age, so that sort of halve your senior age, that makes them middle age, start them on their joint supplements, because there's no such thing as too soon for supplements. Absolutely recommend keeping up on that for sure. So something like any kind of Dasequin, Cosequin's another great one. The Wild One supplements. I'm sure you can share all of these.
Yeah, I'll throw a bunch of, we have some great articles on the Preventavet site that talk about being proactive against arthritis for those of us with young or middle-aged dogs, but then also a lot of resources for, okay, my dog is dealing with arthritis, what can I do? So mobility tips, supplements, medications, treatments that you can do. I'll share a photo really quick that Stephanie sent me earlier of her lab doing hydrotherapy and like conditioning, right? Things like this, connecting with a facility where they can do this kind of low impact exercise, right? Especially if you have joint problems, you don't want to be pounding on the pavement on long walks or things. So really, looking at it holistically and kind of approaching it from ways other than just pain meds right off the bat. So getting started with those, connecting with your veterinarian, they can refer you out to great people who do those services as well. But I'm definitely going to start Fozzie Bear on supplements much sooner than I did Sookie. She was like 9 or 10 when I started adding it. And then I do fish oil as another one.
Yes. Fish oil is a great one as well. And that's just an age-old one that before the company's got a hold of this, oh, hang on, we can add things to this fish oil. Fish oil is just an old school, I want to say old school, but like not necessarily bad school, just old school, but still a great one. So if you want to go the old school route, but not necessarily bad school, fish oil is perfectly acceptable too.
Awesome. We did have a question come in related to mobility from Joanne, and she asked, my senior dog of 12 has hip dysplasia in one hip. What can I do to ease his pain? And then she asked, does CBD oil help, and how do I determine the best product? So before you address this, Stephanie, I want to hop in and talk just very quickly about how veterinarians walk a very thin line when it comes to discussing cannabis products, because I looked it up so that I can say it right and official. According to the American Veterinary Medical Association, under current federal and state law, veterinarians may not administer, dispense, prescribe, or recommend cannabis or its products for animals. So veterinarians can risk their license if they are recommending these products just because there's not enough studies done yet. What's great is places like Cornell, Colorado State University, the AKC Canine Health Foundation, they are funding studies to look into CBD and its benefits and effects on dogs, especially when it comes to pain, seizures, lots of different things. So fortunately, I'm excited to see what comes out of those studies, but because there's not enough data to really rely on, veterinarians have to be very careful in what they are recommending to their patients. So I kind of wanted to let you off the hook on that one. One thing I know is if you are looking into CBD, do your research on it, right? It's not regulated. It's like a supplement, right? So there is some FDA oversight on certain things, but it's a wild, wild west out there. You want to make sure you know who is creating the product, where it's sourced, what's in it, because THC is toxic to pets. So you want to make sure that there's none of that in there, all of that. So don't just run to, you know, the local weed store and ask the kid behind the counter, what should I give my dog? They don't know. And they're focusing more on humans too. So do your research. There are some great brands that I have heard of, and in the resources that I'll send out, I'll include an article that talks about why vets can't talk about it. But then also some resources to kind of research and find perhaps a brand that might work for you. But what do you say for that question regarding hip dysplasia, and as far as what she can ask her vet for, you know, about CBD and what she should make sure she tells them?
Yeah, so I mean, there are definitely medications out there that can be beneficial for hip dysplasia for sure. You know, things like I had mentioned, the Galliprant, the gabapentin, they are all great medications. And if your dog isn't already on them, they are definitely medications I would talk to your veterinarian about for sure. Even the joint supplements, definitely beneficial. You know, all of these are great medications to help make your dog more comfortable. You know, anything like that is going to just decrease inflammation, decrease pain, and increase circulation to the joints. So that's where I would start and go from there. And maybe your veterinarian has a bit more experience or has, you know, the licensing, depending on where you are, as to whether they are allowed to discuss more openly about CBD. And if so, then maybe they're able to talk about it.
Yeah. And you do want to make sure that you tell your veterinarian, I want to try CBD, so that they can make sure that anything else the dog is taking, there isn't going to be any interactions or anything like that, right?
Yes, exactly. You absolutely need to be open, just like with your human doctor. You have to be open about everything you give your pet. We are non-judgmental. I promise you that. Please be open with everything you're giving your pet, because any other medication we prescribe could have an influence on your dog and could interact, and that could be a bad interaction. So we absolutely need to know.
Yes, definitely. Okay. Cognitive decline, doggy dementia, right? I feel like, what were you telling me earlier, Stephanie, where it's almost like for smaller dogs, they live longer. So we see a lot more cognitive decline simply because they live longer compared to bigger dogs. So the bigger dog's body gives out before we see that decline. How did you word it? Because I thought it was so good and such a good point.
I know, I was trying to think about how I worded it before too. So often what we do see is that their body tends to fail before their mind does. And this typically is just purely because, unfortunately, dogs just don't live as long as we do. As much as I'd like to admit that wasn't the case, it is the case. But it tends to occur more in bigger dogs because of that age span or the lack of age span there than it does in smaller dogs. So we do tend to see that bigger dogs, their body will give out before their mind does. Not always the case, of course, but it does tend to be that way. And that's what happened with my lab too. You know, it was her body that went before her mind did, which was hard to see, because you want to be like, can I just replace your body and you'll still be fine? You know, but unfortunately, it's just not always the case. So, you know, there is going to be some cognitive dysfunction that we will see in our pets, particularly if you do own a smaller dog.
Yeah. And what do we tend to see symptom-wise that might indicate cognitive decline? I know from a behavior standpoint, wandering around, kind of like, I don't know where I am, restlessness, right? Kind of just pacing, not knowing what they were supposed to be doing.
Yeah.
Barking.
Exactly, pacing. Yeah, random barking, particularly in the middle of the night, you may find that'll happen. Restlessness, pacing, forgetfulness, which sounds strange, but they may forget sort of where they are or who you are. That's a big one. And often, the biggest one though, I think is probably what you had mentioned, is the pacing and the restlessness and the barking. They're the biggest ones we do find. But typically you'll find they'll stare into space, and I think that has to do with the forgetting where they are, or they're sort of not knowing where they are. They'll stare at walls or in corners, maybe get stuck in those places too, because they just don't know how to get out of it. They just they don't know how to back up. They're kind of just like, I'm stuck, so I'm just going to stand here. So it's kind of hard to watch, and it can be distressful to watch. So
yeah. I know one of my clients, her dog who recently passed away, had that cognitive decline, Gus. And he started really showing it when he would just go to the bathroom out of the blue in the house, and then seem really confused about what had just happened. So I know that incontinence and kind of those potty issues. So a lot of times when I have a client with a senior dog who's like, oh, all of a sudden he's peeing in the house, I'm like, let's look at some other reasons why that might be happening that are going on in his brain because he's aging, right?
Yeah.
So kind of those behavioral changes, you just have to be aware of them. Is there any kind of treatment or medication supplements that veterinarians look at for cognitive dysfunction?
I mean, the first thing first is obviously, just like everything else, we've got to rule out medical issues first. There are always medical issues that can look like cognitive dysfunction. So we've got to rule out those first. If we can rule out all of those, and then we can rule in cognitive dysfunction, there are some medications that have been shown to work in some cases, not all, but in some. So we can always try those. There's supplements that people have tried as well. Whether they're beneficial, unfortunately, I haven't tried them personally. I haven't had a lot of cognitive dysfunction cases because, again, unfortunately, body tends to go before mind. So I haven't had a lot of those cases particularly. And I think a lot of people, think about quality of life. And when it comes down to cognitive dysfunction, again, it is very distressing to watch and see. And I think people get to the point where, they start to think about quality of life. And, I think watching cognitive dysfunction is distressing for pet and for owner. So it becomes a, if I was them type situation, would I want to be in this situation? So, I think there definitely are medications, but I think it comes back to the enrichment part. Is there a way that we could prevent cognitive dysfunction with enrichment prior to this happening? If we had kept their mind functioning from an earlier age, is there a way we could have staved it off? It's possible. Again, I would have to, read on studies or know if there were studies done to determine whether that's the case or not. So again, keep them enriched with, their sniffaries and their snuffle mats and things. And hopefully that'll stave it off.
Keep that brain muscle going, right? As long as you can, use it or lose it. Yeah,
exactly.
It's a tough one to watch. You're right. It's just heartbreaking to see them kind of not know what's going on or where they are, not recognize you, like they used to. It's just heartbreaking. Dental issues. Okay, I'm going to shame myself here. This is my least favorite dog care thing because I suck at it. Like really bad. I'm not good at brushing my dog's teeth. Remembering to do it I'm just not good at it. And my girl Suki, she had big dental surgery. I don't know, this last year has been a blur. So maybe in the last year, maybe just before COVID, I can't remember, where 2 extractions and then big dental cleaning. And then I got the lecture afterwards of, you need to brush your teeth every day. Here's how to do it. And I'm laughing because I'm like, oh, I know exactly what you're supposed to do to teach your dog to get their teeth brushed. But when it comes to senior dogs and their tooth health, why is it so important? And then what can we do to feel better about really working with our veterinarians for dental cleanings and going under anesthesia? And is there anything that we can do at home that's really been proven to work?
So, I mean, the thing about dental disease is that dental disease leads to so many other problems. So systemic disease can come from dental disease to systemic disease means whole body disease. So you get a lot of bacteria up into your teeth, then bacteria leads into the bloodstream, and then into the bloodstream, obviously our blood goes all over our body and it leads to all other problems. So You know, what do they say? The eyes are the windows to the soul. The teeth is the window to the rest of the body. So you get a disease in your teeth, you get a disease in the rest of your body. So it's very important to take care of the teeth. And people don't realize, because you don't look in the dog's mouth as much, but no one wants doggy breath. It smells, it's bad, but when it does smell and it's bad, that means there's something wrong. So it's very important to take care of them, but no one wants to do it because it's expensive. But the more you are in denial about it, the more expensive it becomes. I can tell you that. I do dentals every week. I can tell you how expensive they become with as many teeth as I have to pull out. The more teeth I have to pull out, the more expensive it becomes. So it's cheaper because when it is less teeth I have to pull out, because all it is a quick clean and polish. Your dog is under anesthesia for a less amount of time, which means less stress and less risk for your pet, and less stress for you. And it's just a quick clean and polish. We're just checking everything is okay. Less things we have to take out, less things we have to worry about. But if you're worried about anesthesia risk and anesthesia time, and then how much money it's going to cost you, then you need to be doing regular dentals and regular checkups. And then on my end, I'm worried about, if your dog has teeth that are rotting out of their head, I'm worried about all that bacteria and pus and things that are going up into their bloodstream and then down into their heart and their kidneys and their liver. And now they have a kidney infection and a liver infection and all these problems that I now have to fix, and could become permanent problems and could shorten their lifespan. So it really, really is a big problem. And it isn't something that should be taken lightly, and something that I really would recommend that you definitely look into it. And definitely take care of their teeth. And don't be in denial like me and Cathy.
I was joking with you earlier. I was like, some days it's hard for me to remember to brush my own teeth. So like adding in 2 dogs into that whole routine.
Yeah.
One more thing, right? But you're right.
Yeah, exactly.
It affects so many things. And it is expensive. Like when you have 2 extractions, right? Longer anesthesia time, it's expensive. I went to a couple of vets to get quotes. And then I realized my regular veterinary clinic, it's more expensive because they provided the kind of team that I realized I wanted with a senior dog going under anesthesia, right? Someone just to monitor the anesthesia itself, someone to monitor vitals. I think it was a team of 5, and that costs money. And so I was like, that is worth it to me, but I really need to do better going forward with Fozzie Bear going forward, right? So that he doesn't have those kind of things as a senior. But yeah, exactly. It's crazy. Sticking in the head area here. So eye issues. We go from teeth to eye. I realized that like eye issues were a thing in my breeder's line when I took my dog up to pick up Fozzie Bear. I brought Sookie with me because it's the same breeder. And I remember her looking at her and she's going, oh, her eyes look so good. Like her sister's eyes are more cloudy and she has a bit more issues. And I was like, wow, I didn't even really think about how good Sookie's eyes were. So what kind of eye issues do you see in senior dogs, and kind of what do those look like?
So probably the most common eye issues we see, particularly in older dogs, are something called lenticular sclerosis, or some doctors will call it nuclear sclerosis, the same thing, as well as cataracts. And then there are some other ones that are a little bit less common, but still pretty common in older dogs. But the most common one is probably lenticular sclerosis. Excuse me, all my hair is attached to my earring here. And this is pretty common. People get it very confused. They're like, oh yeah, my dog has cataracts. But it's actually when we see that the lens of the eye starts to sort of gray over, or kind of gets this grayish bluish tinge to it. It's the lens itself starts to thicken and harden, and it's just a process of aging. And so it gets this bluish grayish tinge to it. It typically occurs in both eyes. People are like, oh yeah, my dog has cataracts, but it's not actually cataracts. And it doesn't generally affect their vision necessarily. But if you just look at an older dog, you'll just see it kind of looks like this like haze over their eyes. Whereas cataracts themselves, they're actually a really a white sort of really white, sort of cloudy, opaque color to them. They almost look 3D in a way. Like if you look at them themselves, they really look 3D, like they're floating in the eye almost. And they can be one eye or the other or both. So there really is a difference to them. But typically in dogs over the age of 9, they say that 50% of dogs over the age of 9 will have lenticular sclerosis or cataracts or both, and 100% of dogs over the age of 13. So really, really common in older dogs. And typically a dog with lenticular sclerosis will develop what they call senile cataracts. So it's a casual relationship. They don't say that they definitely go hand in hand, but they say most dogs with lenticular sclerosis develop senile cataracts just due to the aging lens. So it's pretty common. And again, cataracts are the ones that do affect eyesight versus lenticular sclerosis, because that changes the ability of the light penetrating the retina. So that's what causes diminished vision there. And so you may notice that that's when your pup has a little bit more trouble actually, bumping into things, etc. So that's the hardest thing. Other less common but still possible causes in dogs' eyes, and this actually happened to one of my favorite senior patients more recently, is degeneration of the cornea itself. So the cornea is that top layer of skin on the eye. So it degenerates, and you can actually get, and this relates back to obesity and why we need to change dogs' diets, degeneration or lipidosis or fatty droplets on the eye itself or the cornea. And you get this little ring of white fat around the cornea. And that occurs in senior dogs. And this pup itself had high fat in his blood, and that was purely due to dietary reasons. And it can also be due to other reasons in their blood work. This dog didn't have those reasons, didn't have medical reasons for it. We did all the blood work. We made sure it wasn't that. The only thing in the blood work was, hey, you have high fat content in your blood work. So we need to put you on, we need to change your diet. We need to put you on a senior diet, which is exactly what we're doing, which has a low fat content to take this fat down on this dog's eye, which is quite literally a senior dog problem only. So yeah, pretty common. But what did I say? 100% of the time, dog over 13 years of age will see this hazy eye sort of appearance. So yeah, take a look at that.
More like in depth, like a cataract. Like I never realized that it's just there was something else that could be interesting.
Yeah. Everyone's like, oh, my dog has cataracts. You're like, no, it's just lenticular sclerosis, which is a good thing. Like I'd rather my dog be able to see.
Right. So we did have a question from Amy, where she was looking for advice for her senior dog who's losing his sight due to cataracts. He still has one eye that may be eligible for cataract surgery. However, her vet said that dogs adjust really well to blindness and intimated that cataract surgery wasn't worth it. And I think this is a great question because it does kind of speak to blindness overall in dogs who do lose their sight as they get older. Dogs are very resilient. And so as long as we help them adjust, right, and we help them out, right, by making sure we're not changing the furniture in your house all the time and making sure that they learn how to navigate their environment and supporting them in other ways, losing their sight, losing their hearing, losing a whole leg, dogs are very resilient with these kinds of changes. And so I think Amy's vet has a good point where it's like weigh the pros and cons here as far as what you want to address and what that entails. But what do you think about that as far as one eye having the surgery in a senior dog?
Yeah, I absolutely agree. I mean, it really depends on your dog and how you think your dog is going to handle it. But really the biggest thing is helping them, out by not changing a whole lot of things around. Don't go and buy a whole bunch of new furniture and completely redesign your entire living room. That's not fair. Don't go and decide you're going to redesign your home because you've got a aging dog that can't see as well. So just maintain their living quarters the way it was before, and they'll do just fine. They have a lot of other senses, so, as we do too, but they've got a lot of other defined senses. their sense of smell. They have whiskers for a reason. They use them to navigate ways, their sense of hearing, etc. So, I think it'll be fine. If your veterinarian thinks it's the right thing for your dog, then I think it'll be fine.
Great. We did have another question sent in related to eyesight and a dog going blind from Pat, who was asking it's a Dachshund Basset mix who went blind in both eyes due to detached retinas because of high blood pressure. And she was wondering, is there a surgery or any type of procedure to give him even partial sight back? Is that a thing for dogs who have detached retinas and lose their sight?
So it absolutely is a thing. There is surgery to reattach retinas. It is done by veterinary ophthalmologists. If that is something that is beneficial for that dog and their situation, which will be determined by their veterinary ophthalmologist. So it's possible, depending on the cause of their retinal detachment, and whether the cause of the detachment is under control now, and it's not going to keep recurring, etc. So there's a lot of different questions that need to be answered before they can just jump in and reattach the retinas, etc. But you just have to work with your veterinarian and your veterinary ophthalmologist and determine if that's the right thing for your dog.
Everything's so unique to each dog. So it's always like, talk to your veterinarian, use that support team that they provide, right? That they bring.
Yes.
And really make sure that you're providing your dog with the best that you can do, right, for that situation. Last thing I want to talk about before hitting Q&A, because you were so nice to stay with me this late, and everyone as well who's around, because you and I mean, we talked about this stuff for like almost an hour and a half earlier today, and we still have talked about it this much tonight. So we could go on forever.
Yes.
I want to talk about dogs who lose their hearing. Again, something that happens as you age. Laura, I see your dog and adorable. So there's this thing on the behavior side where people are like, oh, he's just, selectively listening. He's selectively deaf. That is very common for dogs. We are talking all the time, and most of the time it has nothing to do with them. So they have learned to tune us out. So there is selective hearing loss compared to actually losing your hearing as you're getting older, right? As a senior dog.
Yes.
Yes. How does a veterinarian tell if a dog is losing its hearing?
So it's very true. There is selective hearing, just like with, significant others and children. They also have selective hearing. I'm sure we can all agree with that. But it is true. They actually do go through hearing loss. It's much harder to tell in dogs than in people. I believe there are a couple of maybe universities that do actual hearing tests now, but the biggest way to tell is if your dog is hard to wake up, via verbal cues, touching them, of course, that's different. That's not going to indicate hearing loss. But if they become startled easily, so you're going up to them and you're talking to them, but then you touch them and all of a sudden they jump, like they had no idea you were coming up to them. Especially if you have wood floors and you're clomping up to them, and they have no idea you're coming. You're calling their name. You approach them from behind. They can't hear you coming. You're wearing socks, whatever. That's a really good cue that perhaps they can't hear you. You're clicking your fingers, whatever you're doing, and they just have no idea. You can tell if they are, if it's selective hearing, if all of a sudden you peel open the can of food or you shake the treat bag and they come running, selective hearing. So that's a very good way to determine the difference. They come running for the treat bag, but they don't come running when you call their name.
Then it's an issue that you talk to your trainer, because no dog is too old to learn new things.
Yeah.
Right?
Yeah.
And anyone too, I've heard one of my vets that I worked with was like, I like using a clicker, which is a training thing, to see if there's any hearing loss, especially with dogs who were clicker trained, because it's such an automatic reaction of excitement when they hear a click, because they know what it means, good things are coming. And if they click and they don't respond, they're like, that tells me something's going on with their hearing, because that is it's a response that's so ingrained in them that if they hear it, it's like they can't even help but go, where's the treat? right? And so if they see that change, then they're like, something's happening. So
yeah, exactly. So
recommend if a dog is losing hearing? Is it really just about changing a little bit of our behavior so we don't startle the dog, or is there any treatment?
Exactly.
Yeah.
So there isn't really a lot of treatment, unfortunately. It's just a case of changing our behavior to recognize what's happening with them. So you've just got to be a little bit more understanding of an aging pet, and try not to startle them, because especially if you startle them, they may react in a manner that may not be appropriate per se. If you startle a pet, they could accidentally bite you, or they could become aggressive because they were startled at the end of the day. So just be really careful about that, and just act appropriately. Pat them gently, try and create vibrations, as you're coming up to them, create wind in their face or whatever it is, so that they are a little bit more like, oh, open my eyes. Oh, hi, mom. Hi, you're there. Etc., so that they can hear you coming. Not hear you coming. They can feel that you're coming, opposed to hear you coming. Just have to be really careful. And especially if you're outside, and normally they used to be able to hear the traffic. Don't let them off leash, things like that. If you live in a high traffic area like where I do, definitely not recommended.
Great tips on that. I didn't think about that. Because you're right, they wouldn't hear something coming. And so they're in their own world. Interesting.
Yeah.
Okay. Thank you so much again for sticking with me this long. I remember I told Dr. Stephanie, you guys, that, I try not to go more than 10, 15 minutes over. So I'll aim for that. And I'm 30 minutes over. So go, Cathy.
Totally fine. I enjoyed it. I could talk about old dogs all day. So
I wanted
favorite
to
topic
through and make sure that I didn't miss, I'm sure I missed some questions, because I think I saw a couple come in that I haven't asked you yet. But if anyone does have a question, please pop it into the chat. Pardon my dogs, because they're ready for dinner and they keep wanting to tell me that, and be involved. So let's see. What's your secret? Oh, Kathleen had a question. She actually messaged me that she had to leave early, but she was asking about a good brand for booties for senior dogs to wear. I will send that in the resources. We have some different ones that I like depending on kind of the style that you want. But one of my favorites for senior dogs are the Paws brand, Pawz, which are reusable, but they're also disposable little rubber booties. So they tend to be a little bit easier to put on. They're lighter weight. And if they're only wearing them indoors to help with flipping and things like that, I recommend punching a couple holes in the bottom so that there's still airflow around the paw, because dogs sweat through their paws and it gets gross and nasty and so that airflow can really help. Obviously, if they're going outside and it's raining, then you don't want holes in the bottom of their booties, because then all the rain and stuff is in with their paw. So that's my favorite brand. Stephanie, do you have any favorite brands that you know of that you've used?
I'll have to think of the link that I used for my lab, but I do like the idea of the Paws brand with the holes on the inside. I was thinking when I was talking about the booties, like, how do you combat the idea of the sweaty paws? So I love that idea, that punching the holes in the bottom, because that's the worst thing ever is, as a veterinarian, I'm going to say, be careful about getting a little infection in their paws if you're wearing them indoors all day. So yeah, I love Cathy's suggestion there, guys, but I'll let Cathy know the link that I used for my pup outside, at least. And if she likes them too, because she's my expert on all things dogs, she can send that link out too.
Awesome. Yeah, I'll make sure we get some resources and some brands that we know work. And let's see, we had another question, Leah. I have a question about the diet for senior dogs. When do I need to change the portion or ingredients? So we did kind of talk about this, where it's as they hit seniorhood, right? So depending on the breed and the size. So more than anything, someone's veterinarian is going to really be able to tell them, yes, now is the time, or no, they're still doing okay. Their body condition looks good. Is the vet really going to be able to narrow that down for someone?
Yeah, so they should be able to narrow it down for them. Again, always doing senior blood work, making sure that everything else looks good and healthy would be the best time to discuss with your veterinarian. Is now a good time to change? And if so, is there a diet you recommend for my dog? You know, does your dog have kidney disease? Does your dog have thyroid disease? Is your dog overweight? You know, what is it specifically that your dog has or doesn't have? Is your dog, you know, 14 and perfectly healthy and just should go on a senior dog diet because, you know, we're going to start to see a reduction in, you know, probably activity. It's going to be some muscle loss and could benefit from the other things in senior dog diet, such as omega-3s and, you know, the other little benefits they have in there. Like I think the one I fed my dog had, you know, already had joint supplements in it, you know, chondroitin and glucosamine and things. So, you know, again, just discuss that sort of nitty gritty with your veterinarian.
Yeah, definitely. The only other question I see that we didn't address earlier was from Kathleen, who was asking about a size of the conditioning equipment. So like fitness and exercise equipment that I showed. So the balance pad, the balance dish, she has that Dane mix. I will send out some resources in the follow-up email. I'll send out some resources of where you can go for virtual classes for conditioning. I'll link to Lori Stevens, who's a certified canine fitness instructor. And I'll also include the link to search. I think there's a directory for rehab vets as well. But everyone's veterinarian should be able to at least refer if there's one local. But they are really the ones that, especially with senior dogs, I would want a veterinarian on board to know, okay, I'm going to start this conditioning plan. These are the things that the exercise we're going to do on this equipment, because they'll be able to make sure that it's appropriate for each dog. But like I mentioned, lots of dog brands for canine fitness. There's Toto Fit, Fit Paws, but a lot of that kind of equipment you can find on the human side for a little bit more affordable. However, there are some things like that FitPaw makes that are shaped specifically for dog exercises. So some things I'm willing to shell out more money for because there's not a human version that I can throw my dog on right now. So I'll make sure to include those links for kind of that conditioning and fitness follow-up as we go. But I love it. I love those. The Fitness for Aging Dogs was an amazing class. I love what I learned. And I think Suki enjoys it too. So, and she did well on the hike that we went on this weekend. So seems to be a little bit stronger. I like seeing that kind of thing. But thank you so much for all of the information. It has been, I've just learned so much listening to you and about senior dogs. And thank you everyone for joining us. I will post this to our YouTube channel and then you'll receive a link to that in the follow-up resource email as well. But if you have any questions about anything or something pops in your head a little later, thinking about what we talked about, feel free to email us. training@preventivevet.com is my direct email, and I'll forward those to Stephanie or answer them if I'm able. And please let us know if you have questions about anything. But thank you so much for joining us tonight, and I hope you all have a wonderful evening. We'll see you next month.
Bye, guys.